What people refer to as a hip scope is truly a hip arthroscopy, which is a minimally invasive surgery of the hip joint. In the last decade or more, based upon some research that started off in Switzerland and then kind of made its way over here, we started to recognize that there were certain patterns in people that would lead to arthritis. Now that we've recognized those patterns and the tears and damage that it starts off with, we've found that if we intervene, if people are having symptoms, we can significantly improve their quality of life at that time, but also the thought or the hope is by doing this, ultimately they'll either delay or avoid that early arthritis. The symptoms are typically pain in your groin or deep in the side of your hip. Oftentimes it's made worse with activity. Typically it's kind of an insidious onset. It's rare that this just hits you between the eyes and you have sudden pain that won't go away. I would say most people by the time they get to me have had pain for many months, if not years. The vast majority of these people have this phenomenon called hip impingement or FAI. For those people, the published success rates of the surgery are somewhere between 80 and 90%. Again, it depends on age, degree of damage, and things like that.
I was pretty involved in doing different activities. I would do bike rides, I did fitness classes, boot camp classes, that kind of thing. And over time, I discovered it just became a constant dull ache. And then the dull ache became a little bit of a pain, and then the little bit of a pain kind of became a sharp pain, and it just continued to escalate. I had gone to a couple of different doctors and they had kind of recommended, hey, if bike riding hurts your hip, maybe you should stop bike riding. And you know, that just wasn't an option for me. I didn't feel like I was at a position or a time in my life where I wanted to quit doing my activities.
Pain that people have that leads to a hip arthroscopy is typically caused from damage to the soft tissues in your hip. Your hip's a ball and socket joint, and around the edge of the socket there's a rim of tissue called your labrum. And the majority of the pathology that we see in the hip is related to damage to the labrum. And once the labrum is damaged, either it's detaching from the bone or it's split or something like that, that is typically what will start to cause the pain. Now, why the labrum tears is a whole nother issue. Occasionally the labrum will tear just from a traumatic injury, but most of the time it tears because people's ball and socket don't fit correctly, and that's where this impingement phenomenon, where either the socket is too deep or rotated a certain way, or the ball, which normally is shaped kind of like a light bulb and there's clearance on either side, sometimes that ball will have an extra bump of bone called a cam lesion. And if that cam lesion abuts against the edge of the socket, or if the socket's so deep that there's not enough room, well then that labrum starts to get pinched basically between the ball and the socket, and that's what leads to the damage. And then it can also lead to the cartilage on the socket starting to peel off. The goal is to fix the damage, but then change the anatomy so that, which is what led to the damage, so that it doesn't recur.
Right now I'm about 13 weeks post-surgery, and I feel great. Prior to surgery, it was even painful just to walk. And it was clear I needed to do something. I needed to either make a change in my activity or try and do something to fix my hip. And at this point, everyday walking, I feel great. It's surgery. It's uncomfortable. You know, the first week is uncomfortable. The first week is a little painful, but truthfully, I never felt like it was that, to the degree that it wasn't manageable.
The biggest thing is just the familiarity with what not to do. You know, the nature of the surgery right now is such that that avoidance of kind of hip flexor irritation, not advancing range of motion too quickly, really fine-tuning on a day-to-day, you know, or week-to-week basis with these patients what they're doing. It's not linear in terms of its progression like some other surgeries might be. You know, people, you know, every surgery, people have their good and their bad days, but you know, with these hip scopes, we're finding that that really they may do great for a couple weeks. You know, maybe they introduce a new exercise and they get a little sore for a few days, and so you really have to tailor it to the individual. You know, it's gentle return of range of motion, and it's largely dictated not only by, you know, doctor's protocol, but also by patient's symptoms in response to exercise. Right now, return to sport, depending on the level of sport, if we use that as a gauge, you know, varies. It can be 6 to 9 months. So, you know, you have some real high-level athletes, you know, and if we think lower extremity athletes, soccer players, football players, basketball players, you know, by 9 months, the ideal goal would be that they would be back. But you're going to continue to see improvements for, you know, up to a year afterwards.
Interestingly, this is the fastest growing area of orthopedics right now, the minimally invasive surgery of the hip. I can say in my own practice, it's really become a larger and larger part of my practice and a bigger interest for me because it's been very gratifying to take a group of people that historically, when I was training and early in my practice, I would see and knew they had something wrong, but no one could pinpoint it, and they would be disappointed when they walk out the door because we just couldn't do anything for them. Now to be able to take that same group of people and in 80–90% of the time, if they need surgery to make them better, that's a pretty gratifying thing.